Have you ever noticed changes in your skin, nails, or even the way your breath smells and wondered if they might be telling you something about your health? What many people don't realize is that these seemingly small changes can sometimes point to a problem with your kidneys. At Wellness Science Hub, we believe early awareness can make a huge difference. Kidney disease is far more common than most people think, yet it often develops quietly without obvious symptoms. In fact, a large percentage of people living with chronic kidney disease have no idea they have it. That's what makes early recognition so important. When kidney problems are identified in their early stages, there is often an opportunity to address the underlying cause and slow or even prevent further damage. Today, we'll explore 17 important warning signs that could indicate chronic kidney disease and help protect both your kidney health and your overall well being. Your kidneys are two fist sized organs located near the middle of your back, tucked beneath the lower ribs. Most people know them as the body's filtration system, and while that is certainly one of their primary jobs, their responsibilities go far beyond filtering waste. These organs help maintain proper levels of minerals and electrolytes, regulate acid balance in the bloodstream, support healthy red blood cell production, and play a vital role in keeping bones strong. Because they perform so many critical functions, even subtle signs of trouble deserve attention. One of the earliest clues can appear right in the toilet bowl. We're not talking about a few bubbles that disappear quickly after urinating. Instead, think of a thick layer of foam that remains on the surface for an extended period. When urine consistently looks this way, it may indicate that a protein called albumin is leaking from the bloodstream into the urine. To understand why this happens, imagine the kidneys containing millions of microscopic filtering units. Each filter is designed to allow waste products and excess fluid to pass through while keeping important proteins inside the bloodstream. Specialized cells form a highly selective barrier that acts like a living sieve. When these cells become damaged, tiny gaps can develop, allowing proteins such as albumin to escape. Because albumin behaves similarly to substances found in soap, it can create persistent foam when it mixes with urine. This is why unusually foamy urine can be an important warning sign that should not be ignored. Another sign worth paying attention to is swelling. You can perform a simple check yourself. Press your thumb firmly against the front of your lower leg for several seconds and then release. If an indentation remains for a short time afterward, this is known as pitting edema. The connection between swelling and kidney disease often comes back to albumin loss. Albumin helps keep fluid inside blood vessels. When albumin levels drop because it is being lost through the urine, fluid can begin escaping into surrounding tissues. Gravity pulls this excess fluid downward, which is why swelling commonly appears in the feet, ankles, and lower legs. Some people may also notice puffiness around the eyes, especially in the morning. Ironically, even though the body appears swollen, the amount of fluid circulating inside the blood vessels may actually decrease. The kidneys can mistakenly interpret this as dehydration and respond by holding on to even more salt and water. As a result, swelling can become progressively worse. In severe situations, excess fluid may accumulate in the lungs, making breathing difficult. Of course, swollen legs do not automatically mean kidney disease. Long hours of standing, certain medications, heart conditions, and other factors can also cause swelling. However, if the swelling becomes persistent, worsens over time, or is accompanied by puffiness around the eyes, it is worth discussing with a healthcare professional. Many people also assume that frequent urination is a sign that their kidneys are working exceptionally well. Surprisingly, that is not always true. When kidney function begins to decline, one of the earliest abilities that may be affected is the kidney's capacity to concentrate urine properly. Normally, during sleep, the kidneys produce smaller amounts of highly concentrated urine. This process is supported by hormonal signals and the fact that we typically consume less fluid overnight. When the kidneys lose this concentrating ability, larger amounts of dilute urine may be produced while sleeping. The result is waking up repeatedly during the night to urinate, a condition known as nocturia. Although there are several possible causes of nocturia, kidney disease is one possibility that should be considered. Your fingernails can also offer valuable clues. A small pale crescent near the base of the nail is perfectly normal and is known as the lunula. It represents a part of the nail that is still developing beneath the surface. In some individuals with chronic kidney disease, however, the nails develop a distinctive appearance known as half and half nails. Instead of a small pale crescent, a larger portion of the nail appears light colored, while the remaining section takes on a reddish-brown shade. Not everyone with kidney disease develops this change, and researchers still don't fully understand why it occurs. Nevertheless, it has long been recognized as a finding frequently associated with chronic kidney problems. Another important issue involves phosphate, a mineral found in many foods. Healthy kidneys efficiently remove excess phosphate from the body. When kidney function declines, phosphate can build up in the bloodstream. Elevated phosphate levels create problems because phosphate readily combines with calcium. Together, they can form calcium phosphate crystals that may settle in various parts of the body. When these deposits accumulate beneath the skin, the condition is known as calcinosis cutis. It often appears as firm, whitish-yellow bumps that may feel hard to the touch. Although these deposits are usually painless, they can occasionally break open and release a thick, chalky material resembling toothpaste. While kidney disease is a common cause, similar deposits can also occur in certain autoimmune conditions. Regardless of the cause, they indicate that calcium and phosphate balance within the body has become disrupted. Unfortunately, these crystal deposits do not always remain limited to the skin. In more serious situations, they can develop inside blood vessels, creating a dangerous condition that interferes with blood flow. When tissues and organs are deprived of oxygen-rich blood, significant complications can occur, sometimes becoming life-threatening. High phosphate levels can also slowly transform the structure of blood vessels themselves. Normally, artery walls are flexible and elastic, allowing them to expand and contract with each heartbeat. Over time, excessive phosphate can trigger changes in the cells that make up these vessel walls. Instead of behaving like normal artery cells, they begin acting more like bone-forming cells, depositing calcium within the vessel wall. As this process continues, arteries gradually lose their flexibility and become increasingly rigid. In advanced cases, the hardened arteries can feel surprisingly firm beneath the skin, almost like a tight cord running underneath the surface. This loss of flexibility places additional strain on the cardiovascular system and is one of the many ways kidney disease can affect health far beyond the kidneys themselves. By now, it's clear that rising phosphate levels can create serious problems throughout the body. To keep phosphate under control, the body relies on a hormone called FGF23. This hormone acts as a messenger, instructing the kidneys to remove more phosphate through the urine. At the same time, it signals the digestive system to absorb less phosphate from food. Unfortunately, this process also reduces the activation of vitamin D, which means the body absorbs less calcium as well. As calcium levels begin to decline, a variety of symptoms can develop. One of the most common and uncomfortable is muscle cramping. These cramps often strike at night, just as you're trying to relax or fall asleep, and they can be surprisingly intense. However, calcium isn't always the only factor involved. In the early stages of kidney disease, magnesium levels can also drop. Increased acidity in the bloodstream may contribute as well. Together, these imbalances can create the perfect conditions for frequent and painful muscle cramps. If you're experiencing recurring cramps without an obvious explanation, especially if you haven't recently increased your physical activity, it may be worthwhile to have your kidney function and electrolyte levels evaluated. The body's efforts to maintain calcium balance can create another problem over time. When calcium levels remain low, the parathyroid glands release parathyroid hormone. This hormone helps restore calcium levels by pulling calcium out of the bones and releasing it into the bloodstream. In the short term, this strategy works remarkably well. The body gets the calcium it needs, and vital functions continue. The problem is that if this process continues for months or years, the bones gradually lose their strength. They become thinner, weaker, and far more likely to fracture. This condition is known as osteoporosis. One warning sign that often goes unnoticed is a gradual decrease in height. When someone tells me they are noticeably shorter than they were years ago, it immediately raises concern about bone loss. Fragility fractures are another major clue. If a person breaks a wrist, hip, or vertebra after what should have been a relatively minor fall, weakened bones may be to blame. Kidney disease doesn't just affect minerals and bones. As kidney function declines, waste products that should normally be filtered out begin accumulating in the bloodstream. This buildup is known as uremia. Put simply, it means substances that should leave the body through urine are instead remaining in circulation. One of the earliest and most frustrating symptoms of uremia is severe itching. Unlike the occasional itch everyone experiences, this tends to be widespread, persistent, and often much worse at night. For some people, it becomes so intense that it disrupts sleep and leads to constant scratching. There have been cases where individuals sought medical attention only after scratching their skin to the point of injury, only to discover advanced kidney disease during testing. Researchers believe several factors contribute to this symptom. Waste products can accumulate within the skin itself, causing irritation. These toxins may also activate specialized itch receptors, making the nerves far more sensitive than normal. Over time, they can even affect areas of the brain involved in processing itch sensations, creating a cycle that becomes incredibly difficult to ignore. Another sleep disrupting condition that has strong links to kidney disease is restless leg syndrome. Anyone who has experienced it knows how frustrating it can be. The moment you lie down to rest, an overwhelming urge to move your legs takes over. The sensation is difficult to describe, but impossible to ignore, and symptoms often become most severe at bedtime. Scientists believe one of the key contributors is low iron availability in the brain. Iron is essential for producing dopamine, a chemical messenger involved in movement and nerve signaling. When dopamine production is affected, the uncomfortable sensations associated with restless leg syndrome can develop. So, where do the kidneys fit into this picture? As waste products build up in the body, they trigger ongoing inflammation. This inflammation stimulates the production of a hormone called hepcidin. Under normal circumstances, hepcidin serves an important purpose. During infections, it helps the body hide iron from bacteria by locking iron away in storage and reducing iron absorption from food. This strategy helps prevent harmful microbes from using iron to grow and multiply. The problem is that kidney disease can cause hepcidin levels to remain elevated even when there is no infection present. As a result, iron becomes trapped in storage, leaving the body functionally iron deficient despite having iron available. Over time, this lack of accessible iron can contribute to restless leg syndrome and other symptoms related to iron deficiency. The takeaway is simple. When sleep problems start appearing without a clear explanation, whether it's persistent muscle cramps, relentless itching, repeated nighttime trips to the bathroom, or an uncontrollable urge to move your legs, it may be worth looking beyond the symptoms themselves. Sometimes these issues are early clues that your kidneys are struggling long before more obvious signs appear. As kidney function continues to decline and waste products build up in the body, one of the first things many people notice is a change in the way food tastes. Imagine sitting down to enjoy your favorite meal only to find that everything has a strange metallic flavor. Many people describe it as tasting metal or having the sensation of a coin in their mouth. This happens because waste substances that should normally be removed by the kidneys begin circulating through the bloodstream. Some of these compounds end up in the saliva, where bacteria in the mouth break them down into ammonia and other chemicals. These substances stimulate taste receptors on the tongue, creating that unpleasant metallic sensation. The effects don't stop there. The same compounds can alter the smell of your breath, giving it an odor that is sometimes compared to urine. This condition is known as uremic fever. When food tastes unpleasant and your mouth constantly feels off, it's easy to understand why many people with kidney disease gradually lose interest in eating. Unfortunately, reduced appetite is not simply a reaction to unpleasant tastes. The toxins that accumulate in kidney disease can directly affect areas of the brain responsible for detecting harmful substances. Normally, these brain centers serve as an early warning system, helping protect us from food poisoning and dangerous toxins. When they detect something harmful, they trigger nausea and reduce the desire to eat. The problem is that kidney-related toxins can activate the same protective pathways. As a result, people may develop persistent nausea, episodes of vomiting, poor appetite, and gradual weight loss, despite not intentionally trying to lose weight. Over time, these symptoms can significantly affect overall health and quality of life. Another sign that often surprises people is easy bruising. Some individuals can bump into furniture, doors, or countertops and barely leave a mark. Others develop large bruises from what seems like the smallest injury, or sometimes without remembering any injury at all. Under normal circumstances, tiny blood cells called platelets quickly gather at sites of damage and form a plug to stop bleeding. This process is one of the body's most important defense mechanisms. In chronic kidney disease, however, accumulated toxins interfere with platelet function. The platelets become less effective at sticking together, making it harder for the body to stop minor bleeding. As a result, you may notice bruises appearing more frequently, gums bleeding while brushing your teeth, or occasional nosebleeds that seem more common than usual. While these symptoms can have many causes, they are also recognized complications of advanced kidney dysfunction. One of the most striking signs of severe kidney failure is a condition known as uremic frost. Although uncommon today, it can still occur in advanced cases, especially when treatment has been delayed. In uremic frost, sweat contains such high concentrations of waste products that when the sweat dries, it leaves behind a thin layer of white crystal-like residue on the skin. At first glance, it can look like fine powder or frost covering parts of the body. Seeing this sign is a strong indication that waste products have reached dangerously high levels in the bloodstream and urgent medical care is needed. Another serious complication involves the protective sac that surrounds the heart, called the pericardium. When kidney-related toxins accumulate over long periods, they can trigger inflammation in this tissue, a condition known as pericarditis. Unlike a sore muscle or an inflamed joint, the heart never gets a chance to rest. It continues beating continuously, causing the inflamed layers of tissue to rub against one another. This often produces significant chest discomfort and can create a distinctive scratching sound that healthcare providers may hear through a stethoscope. That sound is literally the inflamed tissues moving against each other with every heartbeat. Moving back to one of the most common complaints people report, let's talk about fatigue. Feeling exhausted is one of the hallmark symptoms of chronic kidney disease, and there are many reasons why it develops. Sleep quality is often disrupted by muscle cramps, persistent itching, frequent nighttime urination, and restless leg syndrome. On top of that, electrolyte imbalances and toxin buildup place additional stress on the body. But there is another major contributor that is often overlooked. Healthy kidneys produce a hormone called erythropoietin, often shortened to EPO. This hormone sends a signal to the bone marrow instructing it to produce red blood cells. Red blood cells are responsible for carrying oxygen throughout the body, providing energy to muscles and organs. When kidney function declines, EPO production drops. As a result, fewer red blood cells are produced, leading to anemia. With less oxygen being delivered to tissues, even simple activities can become exhausting. Climbing stairs, walking short distances, or completing routine daily tasks may suddenly feel much harder than they used to. The good news is that this form of anemia is often treatable. Synthetic versions of EPO can help stimulate red blood cell production and improve energy levels for many patients living with chronic kidney disease. Now, for perhaps the most important sign of all, sometimes there are no symptoms whatsoever. Chronic kidney disease is generally divided into 5 stages, ranging from mild impairment to severe kidney failure. The challenging reality is that many people feel completely normal during the early stages. Symptoms often don't become noticeable until significant kidney function has already been lost. In many cases, kidney disease is discovered unexpectedly during routine blood tests or urine testing performed for another reason. That's why regular health screenings can be so valuable, especially for individuals with risk factors. When it comes to protecting your kidneys, prevention remains one of the most powerful tools available. Kidney damage can develop from a variety of causes, but diabetes and high blood pressure remain the leading contributors worldwide. The encouraging news is that both conditions can often be prevented, managed, or treated effectively when identified early. Another growing concern is the frequent use of over-the-counter pain relievers such as ibuprofen and naproxen. Because these medications are easy to purchase, many people assume they are harmless. However, regular long-term use can place significant strain on the kidneys and may also affect the stomach and cardiovascular system. That doesn't mean these medications should never be used, but they should be taken thoughtfully and according to medical guidance. If you're relying on them regularly, it's a good idea to discuss kidney monitoring with your healthcare provider. Your kidneys work around the clock every single day, performing countless tasks that keep your body functioning properly. The more we understand the warning signs of kidney disease, the better our chances of identifying problems early and protecting these remarkable organs for years to come. Hopefully, this information has given you a deeper appreciation for just how much your kidneys do behind the scenes and why taking care of them is so important. At Wellness Science Hub, our goal is to help you make informed decisions about your health using practical, evidence-based information. Stay curious, stay proactive about your health, and we'll see you in the next video.